Okay, let's try this again. Welcome everyone to the webinar. Now, 7 minutes a little behind schedule, but we're all here. We're here to discuss IAQ in the age of COVID-19, arming your business to support your customers and making the right choice. Thank you for coming today. I hope everyone's families are healthy and safe. As I said before, I'm Amy Belay. I'm the Vice President of Contractor Success at Pearl, and I'm pleased to be hosting this webinar in partnership with Energy Circle. We are passionate about providing valuable insights and information to help you weather this crisis and to thrive on the other side of it. A couple of housekeeping items. As I mentioned, everyone is muted given the number of attendees. If you have a question, please use the Q&A function, which is located in the bottom center console of the toolbar. I'll be managing the questions and our presenters will answer as many as we can at the end of the presentation. We are recording this webinar. We will share it we'll share the link to the recording as soon as we can in the next couple of days. You are welcome to use the chat box throughout. I may not be watching it as closely as I'll be running the slides today. So for those of you who may not know Pearl, Pearl certification documents the energy efficiency and solar high performing features of a home and translates it into a language that real estate agents, appraisers, and lenders can understand. Pearl works with an elite group of contractors in HVAC, solar, and home performance. Our national partners include the Department of Energy, Energy Star, the National Association of Realtors, and the Appraisal Institute. Pearl certified homes are appraising and selling for on average 5% more. A little bit more about our sponsor before I turn it over to Peter. So Energy Circle is a dynamic team of marketing professionals that work every day with their 400 successful home performance contractors, solar installers, HVAC companies, sustainable architects, and low energy builders across all 50 states. And we're really excited to be working with Energy Circle on this particular webinar. So I'd like to actually introduce our first presenter, which is Peter Troast of Energy Circle. Oops. There we go. So Peter is recognized as one of the country's foremost authorities on marketing and home performance, HVAC, and other efficiency-related contracting companies. He's a passionate advocate for the power of a whole house home performance business and is a popular and high-ranking speaker talking about marketing for contractors at a variety of conferences that touch on HVAC and home performance. In 2015, he received the Tony Woods Award for Excellence in Advancing the Home Performance Industry and is an influential contributor to thought leadership and market strategy, and a fellow board member of mine on the Building Performance Association board. Without further ado, Peter, I will turn it over to you.
Great, Amy, is my sound working?
Yeah, you sound great.
Okay, terrific. Good afternoon, everybody. Thanks for enduring a little bit of technical challenge. All right, so here's what I want to discuss. First of all, the Healthy Homes movement, I think of it as, is something that I've been following pretty passionately for quite a long time. And so what I wanted to start with is what is the state of that opportunity for high performance building companies and retrofit companies before the advent of COVID-19. And then I want to show a little bit of data about the COVID and what's happened since, and then share a few thoughts and observations. So does that make sense?
Sounds great.
Am my sound still okay?
Yep, you're great.
All right. Okay, great. So the way I want to start this is really with this question of that many of us have been thinking about, have been following this trend for some time, right? This has been around, and I think many of our hopes have been really high in terms of the opportunity that could exist as people begin to be more aware of the issues of indoor air quality in their homes, the fact that air pollution inside of homes can be vastly worse than it is outside. And many of us have been sort of talking about this as the tidal wave and asking whether it's ever going to break. So, so what I'm going to do now is just go through some really quick slides in the interest of time. There's a lot more data to share here, but I just want to share a little bit just to kind of frame the discussion. So we can go to the next slide, Amy. So what we're looking at here is Google Trends data. And what I love about Google Trends is it gives you a way to sort of assess the sort of general mindset of the people. What we're looking at here is from 2004 to present. So it's a big, long set of data. And this is interest in the term healthy home as a search term. And so what you see over the course of most of this time is fairly steady growth in terms of the interest level in this. And in particular, and I ran this literally yesterday, what you see since the advent of COVID is a very sharp spike in what's going on. So that's a pretty encouraging thing, but stay with me because I want to, you know, I've got some more detail on exactly what that means. Next slide, please. I thought just because we put IAQ in the title, I would just frame the distinction here between the term healthy home and the term indoor air quality. And you can see here that the red, which is indoor air quality, is substantially less recognized as a term relative to healthy home. And the reasoning I think behind this is that that indoor air quality is primarily a more technical term, whereas healthy home I think is a more consumer-oriented, more kind of homeowner-oriented term. So just wanted to frame that. It's one of the reasons that I've become an advocate for the concept, for using the terminology healthy home, as opposed to, you know, the subset of it, which is one reference point that is indoor air quality. Next slide, please. The best study on this, and I'm dangerous to show one slide, but stay with me here. The best study that I'm aware of that is statistically valid consumer research on what homeowners think is from the Harvard Joint Center on Housing Studies. It's this report called Healthy Home Remodeling, done in January 2019. The only thing you really need to know about this slide is that the bar charts represent people who have specific or suspected risk concerns about occupant health in their current home. And so don't pay too terribly much attention to the differences between the age groups and so forth, but just suffice it to say that in almost all of those age groups, the concern level is at or around about 50%. So that's pretty impressive. This is, again, statistically valid cross-section of homeowners, and somewhere in the range of about 50% have some degree of concern about it. Next slide, please. Lots of press and lots of high-level press. Your gas stove is bad for you and the planet. Next one. When Elon Musk, says that filtering particulates from the air makes a measurable difference to health, and shouts out Larry Page, the founder of Google, as the guy who turned him on to it, that is certainly an indicator. And next slide. My favorite of all is that when Vogue magazine says that the quality of the air inside your home will have effects on your skin, you would think we could all go take a giant victory lap and say, okay, this is it. We've got it. Next slide. But the real question is, with all of the rise in awareness and all the rise in sort of press and media and so forth and coverage of this, the big question is who's winning. Next slide. That Vogue article says that fortunately for those of us who value space and aesthetics, Dyson has a svelte new model, the Dyson Pure Cool Link, blah, blah, blah. So next slide. So once again, as has been so often the challenge in our industry, a shiny object, and again, this could be a very perfectly good filtration device that is out there, but a shiny object for $499 is what many homeowners may think is the solution to their particular challenge. Next slide. So what is, I think, been most typical for our industry to date, and the successes that we have had have been very much like this particular one. And this is Mike McFarland, many of you know, a fantastic contractor in Redding, California. Mike, and this is a Facebook comment from one of his clients. For the first time, our PG&E bill is less than $1,500, even less than $300. But most importantly, for the first time in 12 years, our son has made it through his first year without a trip to the hospital because the air quality is so much better. The point here is that Mike, although an incredibly successful and very good contractor, was hired by that family to fix their energy bills, to fix their energy efficiency, and in doing so, created a much more habitable environment inside that house. Came for efficiency, saved a kid, and that, I think, is the reality. And so the big challenge that we have is how to drive that. Next slide. And this then frames for me what I call the giant chasm, which is that despite all of this growing awareness of health concerns and the issues inside the home, there is a significant disconnect between that and what we would all understand to be the actual performance of the building. And so, the risk that we have, and unfortunately the data I'm about to show you about COVID really supports us in this direction. The risk is that people assume that the fix is some kind of a simple device, a simple way of kind of filtering the air. So next, let's go to the next slide. All right, so we're daily, the Energy Circle team is watching this data to try to figure out, what is happening, and I think it's very important to say that that it is changing rapidly with every passing day. So I just want to show you a little bit of what we have gleaned in terms of kind of what's on people's mindset right now. So let's go to the next slide. Just wanted to share again, the same one I showed you before. Over a long period of time, we're seeing a really nice little healthy spike during COVID around the term healthy home. So that's a positive trend. But we go to the next slide. What is underlying this is that the biggest single thing that is exploding here are searches related to air purification. And so this is how Google reports on kind of the rising search terms. We're looking at Google data for the last 30 days. So taken, 30 days before April 20th. So really the heart of the COVID thing. When Google describes something as a breakout search term, that means its growth has been by more than 5,000%. And if you look down this list, what you see, are a couple things. First of all, people curious about what is the best air purifier for viruses, right? So very super connected to like what's gonna keep my house healthy if someone inside the house brings in the virus. You also see a whole ton of specific brands, right? Winix and Honeywell and so forth. And then you also start to see what I think is very important, and a perfect handoff in just a second to Nathan, which is curiosity and questioning about different types of technologies, ultraviolet, UV, HEPA, ion, et cetera. So I think what we're seeing here with this explosive growth in air purification is a lot of what's on people's minds, which is how do I fix this? Is this my solution? And then what kinds of products or technologies out there are valid? And I'm psyched that that Nathan's here to kind of give us a little bit of truth telling about which of these are relevant. Next slide. The one other thing I wanted to just mention here is the other category that has exploded as well, and this is not particularly surprising, is cleaning and disinfecting. So anything related to cleaning and disinfecting has just off the charts. I raise this, you might say that this isn't super relevant to today's discussion, but I think one of the things that we all have to recognize in our potential to deliver a healthier indoor environment is that this is a very, very important issue. And so cleanable surfaces, are kind of central to the idea of making for a more, healthy indoor environment. And I think we tend to, as building scientist types, we tend to think about the envelope and maybe don't focus on this quite as much. Next one. Last one I wanted to show is indoor air quality. And in this case, I changed my graph a little bit to look at 90 days. Not a huge trend line here. Clearly a little bit of a spike you see there before, right before March 30th. The key point I wanted to say about indoor air quality is that the two specific terms that have the most action or the most resonance are about indoor air quality testing and about indoor air quality monitor. And this is one of the central tenets of what we have learned about marketing in this in this area is that the first thing people are thinking about is some kind of a test. How do I know if there's a problem or an issue inside my home? And so so that's very important from a business standpoint, to make sure if you're going to go down this road that you have a diagnostic protocol to offer, because that's what the marketplace is looking for. So next slide. Quick few observations here. For the most part, people are, focused on their immediate health and safety with all of this activity around air purification and cleaning. But I think it is very clear to me that time at home plus these health concerns is a huge opportunity for us. People are open to hearing and learning about healthier homes. I think the ripeness of people for this right now, many people are saying that we've all learned how to work from home, and this trend will continue to accelerate. It is absolutely clear that there continues to be an enormous knowledge gap, right? That divide that I described in that picture is so very much true, and yet people, I think, are more ripe for this message than ever. It is clear that things are fluid and constantly changing on a daily basis. And we can expect the immediate focus of homeowners to evolve. But the last thing I want to say here, and for those of us in this industry, this is a prime opportunity to establish authority and trust. People are questioning these things. They're wondering what technologies work. They're wondering about all these issues, and this is a real chance for us to be the experts and really position ourselves as the authority. And then lastly, this is the term that everyone is using: stay home, stay healthy. And next slide, maybe we just need to take on one more addition to it: stay home, stay healthy, create a healthy home.
Oops. Thanks, Peter. I appreciate that. And this is Peter's contact information. It will also be at the very end of the presentation. So if you don't have it already, you'll have another chance. So I'd like to introduce our next presenter, Nathan Kahre. Nathan is the Business Development Manager at EnergyLogic. He brings his experience working for home builders to bear on his experience and on this conversation. He's worked with builders of all sizes to find improvements and opportunities to go closer to the idea that all homes can be efficient, healthy, and local. He's presented on building science, renewable energy, and home builder quality assurance throughout the country, including at sessions like ResNet, EVA, and IBS. And with that, Nathan, I will turn it over to you.
Wonderful. Well, I want to say thank you to Amy and Peter for asking me to be a part of this. I really want to build on what Peter was talking about. While there's a lot of concern around the coronavirus and a lot of people who are fearful and looking for any option that they can to help protect themselves and their families, there's also a lot of junk science out there, a lot of things to be careful about, both when you're looking for yourself and when recommending options to your clients. And so what I'm going to spend the next couple slides talking about are some different options, some different things that we should be concerned about, and then also some options out there to promote that are going to actually create a healthier home, both in the short term and in the long term. So really what I can't really stress enough is that we should always follow the CDC guidelines, always look for what our nation's forefront in health is saying, and make sure to follow those guidelines. Next slide, please. So I'm going to start off with some common things that we're seeing out there, and some things that even just with a few simple searches, I'm seeing some just people starting to market and push some simple solutions rather than some whole system, whole building thinking around how to improve your home and stay safe. So first one being ozone generators. So ozone, as many may or may not know, it's a reactive compound that can be a part of, well, it's a part of our upper atmosphere and is there to filter out, react, and can help protect us from different things. It's been proven to be effective at killing viruses, bacteria, mold, mildew, and can be effective. The problem is that while it's effective at killing these things, it's also just as reactive with our own body and can cause some pretty serious respiratory issues, and can exacerbate those who already have some issues. Amy, can we go to the next slide? Oh, back one, sorry. Yep. So currently, ozone is not recommended by either the EPA or the CDC as a methodology to combat coronavirus. And I would strongly recommend to anybody, if they're thinking about using one of these, I would say use it only in unoccupied space. They are very effective in industrial settings and in different hospital settings as a way to clean and disinfect these locations. But maybe I would never recommend putting one in your home and using it to clean the air, especially while you're occupying that space. Next slide. Ultraviolet lights. I actually have a little bit of hands-on experience with these. In my undergrad, I spent some time working in a research lab that was working with bacteria, and I had to regularly clean and disinfect a cabinet. And so one day I decided to use the UV light to do that. Ended up giving myself a horrible sunburn on my face and actually causing a little bit of eye damage because of how powerful these lights can be. So while I say they are a very proven method to sterilize and disinfect, when they say can cause sunburns in seconds, that is very true and can cause some pretty significant damage to people. So keeping them away from people is going to be very important. Should never be used to disinfect anything on your body. There is the question about whether this should be used within an HVAC system as a way to disinfect. And I'll say there are some products out there on the market, but you have to be very certain that they are emitting the appropriate light wave. I have listed UVC. There's UVA, UVB, and UVC. UVA is what can cause skin aging. UVB is what causes actual sunburns. UVC is a much shorter wavelength and a much more powerful form of ultraviolet light. So key things to think about: make sure that it's appropriate UV light, that air is moving slow enough. They recommend at minimum that the air is in contact with the light for more than a quarter second. So if it's moving through a supply slide, it's recommended no less than 500 feet per minute of air velocity. So on a typical supply side, that's not going to be effective, but could possibly be effective in the return. So just when you think about ultraviolet light, don't think about getting it on you. Think about using it to possibly disinfect surfaces. But again, this is really a system that's in place for hospital settings. Next slide. Duct cleaning. There's some people who are very big advocates for duct cleaning and some that really are saying that it doesn't work. I would say look to what the EPA says about duct cleaning. It's kind of a contested treatment in improving indoor air quality. But I would say it's really going to be best when it's used after major events in the home, such as a fire, flood, pest situation, anything like that. That will really help improve indoor air quality in those situations. And I would be careful if you are a contractor that is currently providing duct cleaning. Right now, the FCC is monitoring duct cleaning as a potential scam around coronavirus protection. So be careful around that. I would say that in general, duct cleaning can be an effective tool for improving indoor air quality and in creating a healthy home, but around coronavirus, it is not at all. Next slide, please. So some of the proven solutions that we see out there that are backed up by science and possible to make impact both on new and existing homes are the following. Let's go into ventilation first. So ventilation, there's some really interesting research out there. One of them is an article in Nature really showing how virus transmission can be drastically reduced through ventilation. So again, this is really going to depend on how the virus is being transmitted. Close contact through somebody coughing in large droplets, this will not prevent that, but it has a very large chance to reduce aerosol transmission throughout the home, where it could be floating in the air for as much as 3 hours. So increasing ventilation is going to be really effective in reducing that. And it's also highly recommended by the CDC as a way to improve the home and prevent transmission. Air filtration, while a shiny new air filter like the Dyson or others out there is not going to be the end-all be-all solution. It is possible and has the ability to help reduce possible transmission and just improve indoor air quality in general. If you're looking at a whole home system, making sure that it's a MERV 13 or higher is going to be really important. If you're looking at a portable air cleaner, making sure that it is high MERV, but it also can move a large volume of air is going to be very important as well. One of the areas that they think that this will help reduce virus transmission is that that virus strain can land on particulates that can then be recirculated throughout the air. And so trying to prevent that, those particles from being there in the first place is how that can help. Next slide, please. Controlling relative humidity is another proven way to prevent virus transmission and improve the overall health of the home. So ASHRAE has a ton of technical guidance on this, and I would strongly recommend looking to them and following those recommended guidelines. Something to keep in mind, in many parts of the country, it's still fairly cold out. So keeping the air above 40% relative humidity is going to be key, but also make sure that you're not going to prevent issues with condensation that could lead to mold or mildew. It's going to be very important. Next slide. And just some additional resources. Amy, is this slide deck going to end up getting sent out to? Oh.
I muted myself. Yeah, so we'll make sure all of the additional resources you provided are included with the recording when we send it out.
Wonderful, that's great. And if you'd seen, there are several links included with every slide. We'll say, I am not a doctor, I am not a microbiologist, I'm not a public health expert. I'm a building scientist who is passionate about indoor air quality and healthy homes. And so there are plenty of resources for you to do additional research and become more educated about the topics. All right.
Awesome. Thank you, Nathan. So this is Nathan's contact information. Before we wrap up today, I'll be sure to put everyone's contact information up. So as I mentioned at the beginning, please, if you have questions, use the Q&A feature, which you'll find on the bottom of the toolbar, sort of one of the last icons that says Q&A. So we do have a few questions that have been posed. One is, how is everyone dealing once interest is gained from a lead in a customer in accessing or installing the IAQ solution? We have many people inquiring but are hesitant in doing it now and are saying when this is over, they'll move forward. I don't know, Peter, do you want to address that question?
Yeah, I mean, I think first of all, this is a very individual thing, right? Depending on your business model, if you're an HVAC and you're considered to be an essential service, and then obviously whether you as a company have decided to go into homes or not go into homes, right? I think a couple things that I would say is one is one of the starting points, if you believe what I said earlier, that it begins with some kind of a diagnostic component. You can place a monitor device of your choice in the home, obviously without any real contact with the homeowner. You can mail it to them, right? And so I think that's my first recommendation for getting started. And my second recommendation, and that is, we've been testing this over the last week, and showing some traction with it, is to start taking reservations. People are, to the point of the question, people are not expecting that they can call a contractor and get an immediate service, but we're seeing that people are interested in not getting left behind once things get started. And so what we have recommended to a lot of our clients is to start moving towards a reservation approach, get on the list, and as soon as we know when we're able to come back into homes, we can do it. And what's that's done is kind of sort of reignited some of the lead flow where it was, where it may have gone completely dead.
So there's another building science question here. Would proven tight ducts between units in a multifamily be worthwhile initiative towards reducing a community-driven virus? And I don't know if either one of you are equipped to answer that.
Definitely not.
Nathan, do you want to? Yeah, this group is not multifamily focused per se. So I'm sure there's a better resource than these two gentlemen.
Yeah, I would recommend going. ASHRAE has some guidelines around the residential space, both in single family homes and in multifamily. And it's I would look to their recommendations.
Okay. Do you have any sense on electrostatic cleaners, if they can help pick up particulates, etc.?
I would say reducing fine particulate matter is always going to be an important piece, and has a possibility to reduce this transmission spread.
Mm-hmm.
Yeah.
Okay. A question for you, Peter. How are you guiding your customers and how they talk to homeowners about IAQ and healthy homes when these things come up?
Well, it's a big topic and one to be super careful about, right? I mean, I am a big fan, first of all, of the term healthier homes. And I think, if you thought the stakes were high before in terms of kind of people's expectations about what you might be able to guarantee, I think they've obviously gotten even that much higher now. So I think the guidance is that, that what we are able to do is take care of very specific things and follow some building science principles that guide us. And among those are things that we all kind of know and love, right? Stopping infiltration. That's right. So that's and I think taking the infiltration from more of an energy efficiency discussion to keep the pollution out discussion, I think is very important to this. And as Nathan said, I think going towards ventilation, which is without making a promise as to what it's going to do, but do make a promise that it makes for a really nice environment inside a house when you have a well-balanced whole house ventilation system. But it is, I think one of the overall challenges in this whole topic area is how we talk to homeowners about it, how we don't overpromise, how we don't set false expectations, how we're careful in situations where people are legitimately sick and not promising solutions. So it's tricky ground.
Yeah, for sure. Dave Curry makes a good point that's worth mentioning, that BPI has their Healthy Home Evaluator certificate, which I think the training is available, and the book is coming very soon on that. And we're actually working to put together a webinar with BPI on that as well. So more to come on that. There was a question about, Nathan, your slide with respect to relative humidity. Do you have any, either can you point people to resources, or do you have any guidance on either levels to achieve or levels to avoid?
Yeah, the ASHRAE has some really good documents on this, and I can probably see if I can send a link out about that. I'll say they have this great slide where it kind of has like bacteria, mold, viruses, dust mites all in there, and then across it has this kind of relative humidity range and where you want to be for all of these. And when you look at viruses, the optimal range is between 50 to 60% relative humidity. I'd say anything above 40 is going to do a great job, and then trying to stay below 60 is really the range that you're going to want to stay in.
Great, thank you for that. There's another question with respect to monitoring devices. This one asks specifically for your recommendations, but perhaps instead of recommending specific products, you might give us some ideas for how people might make those kinds of selections. Either one of you. Peter, do you have any thoughts on that?
Well, I am the last person in the world to be making these recommendations, and sadly, I know more than I would care to about all these devices. So, I think first of all, because of the rapid decline in the cost of sensors, there are more and more devices just on a constant basis, and I think they're getting better. There's a few popular ones out there. There's one called Air Advice that gets used a fair amount in the HVAC industry. One of the nice things about Air Advice is that it produces its own report. It's a push button report, and so it's the kind of thing that is easily installed and plugged in by a homeowner, and you tell them to put it downstairs in week 1 and upstairs in week 2, and then at the end of the field it does it, and it measures CO, CO2, temperature, humidity, PM 2.5, and VOCs. And I believe each one of those is its individual sensor as opposed to proxy sensor. But there's a ton of new products out there. I think my sense is that TruTech Tools, Bill Spohn's company, probably has the best selection of them, and is probably the most trusted retailer from my standpoint in terms of what may be out there. But there's a lot coming on the market, and a lot of good choices, I think.
Nathan, anything you want to add to that?
I would say if you are looking for a source to give you a recommendation, Joe Maddock is, find him on LinkedIn. He, I think personally has about 15 different monitors and has hands-on experience with all of them. I would definitely recommend reaching out to him.
Okay, great. In houses without HVAC, what's the best choice of a new device or system installed to improve indoor air quality?
Oh, I would really look, as much as I hate to suggest the shiny device, look at a room by room air purification product. 2 things to just make sure that you're looking out for when you're looking at these. First off, making sure that they have a high filter and capture rate. Second off, making sure that they're actually moving an appropriate volume of air. Some of these have really high filter rates, but can only move, less than 50 CFM of air. So you're just not filtering a lot. And so look at both of those options, and then also make sure that they're going to be easy to maintain and easy to clean so that they have a long life.
Yeah, that's great. There's been actually a few questions about the Healthy Home Evaluator, and I do see that Larry is on the line, which is awesome. And I'm hoping, Larry, you don't mind me putting you on the spot when asking you to talk a little bit about it, since there is a lot of interest. So I'm going to allow you to talk if you're able to jump on.
Sure, I am. Can you hear me?
Yeah, great.
Okay, so you mentioned the Healthy Home Evaluator. That's something we came out about 4 years ago with, and Kevin Kennedy, Joe Medosh, a whole team of people helped create this certification. So testing and training is available now. There is a prerequisite of 1 of 4 certifications like building analysts to get to that higher level. What we spent the last 2 years doing is creating a lower tier Healthy Housing Principles reference guide and certificate of knowledge exam, kind of like the building science principles, that will be out in mid-May. Kevin Kennedy has been helping write that, and we're very close to the end of that. New audience, kind of lower tier community health workers who are going into the house, working with behavioral conditions and medicines and other things, can start observing what they see around the house in terms of keeping it clean, dry, pest-free, contaminant-free, safe, ventilated, comfortable, and maintained, and say, you know, I'm seeing things here that might be affecting your house. You might need to have someone do something about that. So it's coming out, and I think that that level of principles knowledge is going to be very helpful.
Yeah, thank you for jumping on and for clarifying that. I knew that you had something in the works, and for some reason had conflated that with the HHE, which has been around for a while. So thank you for that. So there are a couple other questions here that are more technical in nature. If you had a choice between a duct system and a mini split, what would be the better choice from an IAQ perspective? Larry, you're welcome to chime in.
No, I have a mini split, but I've seen some of Corbett's videos on mini splits, and you might think that, well, because they don't have ducts, that you don't have issues with keeping them cleaned. And there is a maintenance process that needs to occur with them. So, you know, I think you have to not say that there's a silver bullet here that is going to be the solution. But I have used mini splits, and I really like them. They're quiet and efficient.
Nathan or Peter, do you have anything you want to add to that?
Yeah, my recommendation would be not around whether you have a ducted system or a mini split system for conditioning the home. It's, do you have a ventilation system that works well with whatever conditioning system you've selected? Yeah, that would be my recommendation around that.
Okay, great. I think we're winding down on questions here. So Peter or Nathan, is there anything that you'd like to say to close us out? I'll put our contact information up if you would like to close us out.
Yeah, well, first of all, Amy, thanks for having me, and thanks everybody. Really good set of questions and good discussion. You know, I think I am very bullish about how this is going to go, you know, in terms of how we come out of this and this growing awareness, even though it is kind of right now on the, you know, on the sort of immediate kind of fix. I do think we can get people to a more holistic, you know, more holistic thinking about the indoor air quality. I do think, though, it very much depends on, you know, us as an industry assuming that mantle of the authoritative resource, you know, the ones who can talk the building science and explain a lot of what is on people's minds. And so, you know, since so many people are in a little bit of a downtime now and being able to kind of focus on the business as opposed to in the business, this is a terrific time to kind of lay the foundation for you know, what I believe is going to be a strong rebound around this issue. But it does mean really getting your act together in terms of your content, your services, how you describe this, how you go to market with it, and so forth. And it's a really good time for that now.
I would just follow up with saying, you know, Peter's given a lot of great information about the existing home market and what buyers are thinking. I work for a lot of home builders, and they are all thinking a lot of the same things. We've had a ton of builders reaching out, asking how they can, in the new construction market, improve the indoor air quality in their homes. We've been looking a lot at the Indoor Air Plus home certification coming from the EPA. It's a fantastic, holistic indoor air quality. And while the EPA does not make healthy home claims, it does have a great focus on the healthy home, and it's been a fantastic resource for those builders. So again, just echoing that we see this, that home buyers, homeowners are going to be much more interested in healthy home options as we are moving forward than the energy efficiency options that we've seen in the past.
All right. Well, and with that, I would like to personally thank Energy Circle for sponsoring this webinar and this discussion, and Peter and Nathan in particular, and EnergyLogic for participating and sharing your expertise. And for all of you who attended, it's great to have a lively conversation. And I'm glad to see that you took advantage of the chat, even though I wasn't able to monitor it as closely. And glad you guys are talking with each other. And look forward to more discussions like this in the future. And also, thank you, Larry Zarker, for the cameo appearance. Really appreciated you jumping in. I hope you all have a great rest of your day. Thank you.
Thanks, everybody. Stay safe.
Thanks. Bye.